Hi, the purpose of this demonstration is to demonstrate how vials for immunology would be processed using the MicroMD EMR for tracking information. I have 3 patients that are set up in the EMR under the scheduled visits section, which corresponds to the desktop navigator. Whenever you select your desktop navigator item, it's going to determine what you're displaying on your screen. You can also filter the scheduled visits area so that I'm only seeing those patients that are having vials processed. I can filter just to see those for processing. In my example, I started with 3 patients. The first patient, I have not started the encounter yet, so this icon here is missing. I'll do that one live to show you how that would be performed. The second one has several vials that have already been entered in the system. I wanted to be able to show you a patient that would have a profile with multiple vials already processed. And the third one would be how we would enter vials for a new patient when they're getting their first vial or set of vials. Let's first look at Douglas Green. If I double click on him, it's going to take me into the patient chart, and notice you can see a vial history here. I can see that on June 23rd, September 23rd, and moving upward, this patient received vials. I could drill into any one of those encounters to see the details. But I'm going to go ahead and close that and go back to, it just takes me right back to my desktop. I want to right click and I want to open the encounter. Since the encounter has already been created, it says open. If no encounter for today, this date here, was created, then it would say new encounter for me to create a new one. We'll see that in just a moment. When I open the encounter, you can start to see the history that's already logged for this patient. It's formatted as close as we could get it to your current format in your system. Notice that it loads the information, and all I would do is scroll down to see the most current information. Additionally, you'll have an icon on your desk that would allow you to print this history on a report for your paper chart. It would also allow you to print your vial labels formatted the way you want them, and it would allow you to print your instruction sheets if needed. All of that printing can be done from one tool so that you're not having to move around or go different places to print different items. So this is the comprehensive, where you'll notice that at the very top here, we have the history attempting to mimic the history that you show here. Now, some of the information like this area is not input because I really didn't know when you insert that or how you need that. However, all you would need to do is click in here and you can add anything desired, including your asterisks and separations. So you can see that at any point you can add whatever you need to in this document to make it exactly the way you want it. You can also edit prior entries. Everything would be tracked, but you do have full editing capabilities. So I'm going to go ahead and just close out of this encounter. That would be the comprehensive print that you would get, similar to what you're doing now. Let's look at creating one. So that's a completed one. How do we create one? So this patient here, if I double click, I'm going to open her chart and you'll see that she does have a vial history. She's been in one time 3 months ago for vials or has had an order for vials. I'm going to go ahead and close her chart and process the same exact way just by right clicking. But remember, since no encounter is started, you see no icon here. It's just asking me to create a new encounter. And that's what you would be doing. I would just simply click at the bottom on OK. Everything else is already formatted, and it opens a blank template. The first thing I want to do is click on Encounter, and I want to copy the prior visit. You'll know which one you're wanting because it'll have the complaint as vial, and I want the last vial. That's going to bring in the whole history for me. And then all I have to do is scroll down to add another vial. You have a couple ways you could do it. You can simply copy and paste this text from above by doing your Windows shortcuts Control-C and Control-V. Or if you don't want to copy, you can also use the vial, load vial template. So in this case, this patient's only receiving one arm injection, so I'm going to load that one. If it were 2-arm, we would want to load the 2-arm because it'll give me 2 sections to complete. Now notice this looks a little different than my copy paste because I have some fields that I can actually, I could update these fields manually by typing. And then I can also use pick lists, and we can create these wherever you need them or want them. So original strength, maybe we're going to change the strength to this one, so I can update it here. And maybe they want to go to 2 a week. We could update that there. Not sure how you do your bottle numbers. I'm just going to carry down the other one, and I'm going to repeat my vial strength here. Again, all of this can be formatted however you need it. I think you were doing something like this. You can have whatever it is that you want in here, and you can key in information. Even in these fields where I have pick lists, you're able to just type over that if you want something totally different. So these are completely free text fields that you have the ability to change. And formatting, you just move things around with your standard delete buttons. I'm doing everything on keyboard. Notice I'm not touching any of the toolbars or anything, but you could. And once you have your information entered, you can add notes if you want. You can even go up top and update history here, add things into the history like I showed you before. Once you're done, you just simply say OK, and you click OK on this screen, and notice the icon appears. And now if I double click into that patient again, instead of only having the 1 vial, she now shows 2 vials. First as a new patient on March 20th, and now the updated here. And if I double click that, I get a preview in this screen of the vial information. Again, if you needed to print any of this, you're just going to use your vial printing tool that'll be on your desktop. Now let's look at it from a patient, and when I double click on this patient, you'll notice there's no history. This patient's never been here. It's a brand new patient. We're creating vials for the first time. Same process, right click, new encounter. This time you're gonna just say okay, and this time instead of choosing an established patient template under encounter, we're going to choose a new patient because we've never seen this patient. Now if you're going to be doing it for left and right arm, just choose 1 arm. It doesn't matter if it's left or right because it's not identified until you key that in. Let's just go ahead and do it as a 1-arm patient. Notice it populates the patient's information as much as it has. I set this field up because I wasn't sure what you wanted. I didn't know if it was always going to be history and physical or sometimes history or physical. We can make this whatever it is you want it to be. In here, the referring doctor or the treating doctor could pull. So you can put whatever you want in this field, but we can also have macros like we do on the name to pull the primary care, the referring doctor, and even the doctor within your practice that's going to be treating the patient. So if you wanted it to be Dr. Kuhn in this field, we could have it pulling that as well. So I'll just leave it as question marks for now. I think you get the point there. Formula, again, that's a free text field. We'll say it's left. I think you do like that. I'm not really sure what all you might want. Vial strength, again, remember, we can change this. We can make this whatever we want it to be. Add whatever fields you need to be there, and we could just leave it free text if that's even easier. We'll just do that. Repeat my strength. No change date, there are no notes. Expiration date, let's just say it's good for 90 days, so we'll expire it on September 23rd, 2017. And if I wanted to add notes, just type here, whatever you want. And once I'm completed, I just click OK. And again, I go to my desk to print off any labels or history sheets or information sheets that I need to print. That concludes how to process vials in MicroMD. We've done 3 patients. We did one with a comprehensive history where they had about 6 different series of vials. We did this patient who had 2 series of vials, and we did a new patient. If you have questions, please don't hesitate to reach out to us. Thanks so much.